Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. And I hope you will make use of it. Thank you very much. My dear friends, in the last class, we have been discussing about the central precocious puberty. Previous to that, we have seen the basics of puberty, mini puberty, and role of GnRH, and role of the pituitary gland, etc. And in the next class, we have seen what exactly mean by central precocious puberty. And today we shall see what is exactly the meaning of peripheral precocious puberty. Okay, peripheral precocious puberty. So that we'll study through this particular case. Yes, this is a case. A girl with 5 year and 1 month old. Age of the child is a 5 year and 1 month. So 5 year is nowhere related to puberty. Okay, the initial changes of the puberty will going to start after 8 years in the form of the telarche. So this is a girl. So it is related to telarche, so that is in the 8th month onwards, not before that. So 5 years and 1 month. Okay, now in the past 9 months there is breast enlargement. So this is what mother noticed. Mother has noticed that in the past 9 months, okay, somewhere after 4.5 years, so she now noticed that the girl is having breast enlargement. The breast engorgement or enlargement is not progressive. Okay, this breast enlargement is not progressive. So breast enlargement has been taken up to some phase and then there is static. There is no further development of the breast enlargement. Breast is not progressively enlarging. So as usually occurs in case of puberty. So there is no such changes. So breast enlargement is there for 6 or 7 months. So it comes to some form and later onwards it is static. And there is no history of bleeding. There is no history of bleeding through vagina. That means menarche has not yet started. We can take a message from this. And there is no any midline swelling, etc. Okay, so there is no any midline defects or swellings, etc. Anthropometry was done and anthropometry was normal. And the sexual maturity rating stages is P2, PS1. That is in the Tanner's staging. If you see, breast enlargement is there, but no other sexual changes is there in connections with that. So some of the pubic hair changes, axillary hair changes. So they go hand by hand. So there is no such things. Only the breast is enlarged up to certain extent, and then it is also static. So all the systemic examination is normal. Apart from that, all the systemic examination is normal. So anthropometry is normal. SMRS reading is showing some kind of pubertal changes, which is not progressive thereafter. It is static there. So this is a case, 5 year and 9 month old baby, which is only having breast enlargement. There is no other changes. Okay. Now, in the same case, when you go for some of the investigation and examination, the bone age, TSH and biochemical test were done. Bone age is very important because we know that bone age will going to increase according to the sexual age. The sexual age and bone age, they are interrelated. Whenever the puberty starts, the bone age also increases. In the sense, bone growth also starts. They always go hand by hand. Skeletal changes and as well as puberty changes are always directly proportional to each other. So here bone age was done. The bone age was not again showing any changes. I think chronological age is 5.1 or 5.1 month, whereas the bone age is 5.6 month. That means bone age is in accordance to the chronological age. Okay, so suppose if the bone age was more here, that we can say that yes, pubertal changes has, although the age of the child is only 5 year 1 month, but pubertal changes are progressive. Suppose if the bone age is somewhere around 8.8 or 7.6 like that, that suggests that chronological age and bone age are not matching. Bone age is more advanced than the chronological age, which is one of the symptoms of puberty. Okay, now here it is not like that. Bone age is 5.6 and chronological age is 5.1 month. So they are almost all equal. Now height is not increased. Another important case here is height is not increased, because we know that if the puberty changes are going on, first there will be telarche and afterward there is adenarche, and after adenarche in the female there will be a growth spurt, isn't it? So there should be growth spurt also, but in this child growth is that height is not increased. Height is in according to the age only. TSH was done, it is normal, because that we will discuss later. Hypothyroidism is one of the most common cause of a precocious puberty, especially peripheral precocious puberty nowadays. So that we'll discuss later. But in this case, TSH was done and thyroid function test is normal, and USG is also normal. So USG was done, especially abdominal USG. So that helps to look into the position of the condition of the uterus and also ovaries. Whether ovaries are active, that will be understood by the USG changes. So here pre-pubertal stage, that means even the ovaries are also in the pre-pubertal stage, not in the pubertal stage. Okay, so now LH level was done. LH level is, which is less than 5. If LH level is, luteinizing hormone level is more than 5, again it suggests that puberty changes has begun. But here the LH is again less than 5, again which suggests pre-pubertal change or pre-pubertal stage. So nothing is abnormal in this case, only breast enlargement has been taken place. Okay, so that means breast tissues, then ovaries, then adrenals, testes, etc. These are peripheral target areas, isn't it? So there is some problem in the breast. That means there is some problem in the peripheral part, and CNS is not involved in this case. There is no any problem related to CNS. It looks like that. Why? That we will see. And now, so nothing is abnormal in this case. Only breast enlargement has been taken place. That is also to some extent, which is not progressive. So what we have done is we just assured the mother, just wait for 3 or 4 months. Just wait for 3 or 4 months, because all the investigations are normal. Then again follow up the case. Now we have been following this case since last 2 years. Suppose in the last 2 years, what we have observed is the telarche is not increasing. So child came at 5.1 year. So now it is almost all 7.1 year or 7 years old. In the last 2 years, there is no any attaining of telarche. Number one, breast enlargement was there about 2 years back. The same position is maintained nowadays also, today also. Okay, it is not increasing, and child has not developed any adenarche, and child has not developed any menarche, and even the child has not developed the growth spurt. Okay, so this being the case, one thing is very clear: the pubertal changes are not taking place. Pubertal changes are not taking place. If the pubertal changes are taking place, it should occur in a sequence. First there is telarche, and then it should be progressive. Then there should be adenarche. Then it goes on continue. Then there will be growth spurt, and then there will be menarche. But this type of pattern is not seen in this case. Only breast is enlarged. That is also up to some extent. There onwards, that is also stopped. Now, if you look into this patient is something different from the first patient that we have seen in case of central precocious puberty. In this case, there is only breast bud is enlarged, and there is no other changes taking place, just a repetition. Okay, and menarche like symptoms are not there. Anthropometry, if you see, that also shows the height according to the age, and bone age is also according to the age. Now this is a simple telarche, and none of the other sequential sexual characteristics developed. Okay, telarche has begun in this case to some extent, and then it was not progressive. So we have to take that this is a very simple telarche. But question comes, why this telarche occurred, isn't it? Why this happened? Now, before that, another question: is it physiological or is it pathological? Now, telarche which is happening at 5 years and 1 month old, I think it is never physiological. Usually, physiologically, telarche start at 8 years. Now, 5 years and 1 month only the things are started, so it cannot be a physiological one. है तो ये pathological है. Now, is it telarche is progressive? If it is physiological one, the telarche will be progressive. एक बार breast का development शुरू हो गया तो वो progressive चलेगा. ऐसे नहीं बीच में रुकेगा. Okay, so it is telarchy is progressive? No, this telarchy is progressive, not progressive, non-progressive. So mother is telling that it is not progressive and it is static. So now this is a case of precocious puberty. Definitely, precocious puberty कहीं ना कहीं शुरू हुआ है. Somewhere it is begun, but later onwards it is not continued, but it is begun. Okay, and this is definitely not a case of central precocious puberty, because central precocious puberty follows the sequence. Here there is no sequence. So this is a case of precocious puberty. Which type of precocious puberty? Now we have to understand. First of all, we shall see why this is not the central precocious puberty. The born age of the child is in accordance with the chronological age, therefore it is not central precocious puberty. There is no sequence of events are seen, therefore it is not central precocious puberty. There is no progression thereafter once begun, therefore it is not a central precocious puberty. Internal and external genital organs not shown any changes, any developmental changes, therefore it is not central precocious puberty. In central precocious puberty, because of the action of this gonadotrophin releasing hormones, you will have luteinizing hormone, then you have got follicular stimulating hormone. In the meantime, sequentially you will also have the growth and development and maturation of the internal and external genital organs, which is not seen here, because we have done the USG also. In the USG also it is prepubertal stage only. So only thing which is important is we have to regularly follow up this case and we have to find out. So this is a case of precocious puberty. Now we have to decided that this is not central precocious puberty, therefore this is a case of peripheral precocious puberty. This is a case of peripheral precocious puberty. Now we shall see what do you mean by peripheral precocious puberty. So peripheral precocious puberty is a puberty which is independent of CNS. When I say this is independent of CNS, it is independent of GnRH, gonadotrophin releasing hormone. That means there is no any early production of the GnRH in the pulsatile manner. GnRH will be there, but it should be produced in a pulsatile manner. We have seen that. It is not happening. Therefore, this GnRH is not bringing any of the pubertal changes. So this is not seen in this case, therefore it is not a central precocious puberty. Therefore this is definitely a peripheral precocious puberty which is GnRH independent. So in this case, the puberty changes are not dependent on GnRH and changes will not occur in a sequence. So usually hypothyroidism is one of the most common cause of such peripheral precocious puberty. So how this is going to cause this hypothyroidism will going to cause precocious puberty, we will see in the next class. Okay, so target organs will be either the breast, either the adrenals, or either the adrenals or the testes, etc. Now in this case, changes may be due to overproduction of the androgens from the adrenals. In this case I am talking. So breast changes has happened, no? So that may be because of overproduction of the adrenals, androgens from the adrenals, or it may be some of the overactivation of the ovaries which produce estrogen and progesterone, because which brings some breast changes. But the question comes, why this happened? There may be something which is stimulating the adrenals other than GnRH. So from where that stimulation comes? It may be from some of the drugs that you are taking, it may be because of your wrong lifestyle, or it may be because of your lifestyle and other modifications, okay, like lack of exercise and so many other factors which is produced in the body which mimics the adrenal hormones, or which mimics GnRH, or which mimics follicular cell stimulating hormone. If such things are produced inside the body due to various causes, then independent of the CNS or GnRH, they can directly go and stimulate the adrenals, testes, or the breast tissues. So in this case, that may be the cause. So effect of the drugs and diet, and more likely some of the biochemicals that we are taking, hormonal preparations and so many other chemicals which are used, biochemicals. Okay, so this is a typical case of peripheral precocious puberty, a mild case of peripheral precocious puberty. We have got very advanced cases of peripheral precocious puberty, but here it is very mild because telarche happened and stopped there only. So probably in that particular time period, the child would have been taken some of the food which contains some of the chemicals, the food which contains some hormonal preparations, maybe wrong lifestyle, or maybe the child may be on some of the medication for some other purpose. So that brought this precocious puberty. Again, the changes which occur in the precocious puberty are also two types. Just like in the central precocious puberty, it may be isosexual or it may be heterosexual. What I mean to say is, peripheral puberty changes are taking place, independent of CNS. Telarche is there, and meantime there will be development of the facial hair also is there. Facial hair is also there in female child. So now, these are the two peripheral precocious puberty changes taking place without following the order. Okay, because facial hair in males, it will come at the end. But here, suppose the child already developed the breast development. After 1 year, if the child start, or 6 months, child also started with facial hair. So now it is heterosexual peripheral precocious puberty. Or sometime there is a breast development now, and next what we are expecting is adenarche, axial and as well as pubic hair should develop. But instead of that, menarche started. So this is also a peripheral precocious puberty because we are not following the order. But isosexual, same sex, menarche is also happening and breast development is also taking place. So peripheral precocious puberty is also of two types, isosexual or heterosexual. Now this is the case. So this is a case of peripheral precocious puberty. Okay, peripheral precocious puberty related to the telarche, maybe influence of some of the drugs or some diet regimen, etc. Now, peripheral puberty, precocious puberty is quite common in the present day scenario, so that therefore we have to discuss about that in detail. In the next class, we shall see one of the most important cause of precocious puberty, peripheral precocious puberty, that is hypothyroidism. So that we will discuss in the next class. Thank you very much.